Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Hyperbilirubinemia and its causes. So it is divided into two categories. So first we are going to see the conjugated variety. So the conjugated hyperbilirubinemia. Hyperbilirubinemia. So under this variety, there is the BT obstruction. So it means the bile tract obstruction. This is C. Next is the BT, that is the bile tract diseases. So it includes the bile tract diseases such as the primary biliary cirrhosis. So primary biliary cirrhosis and also the primary sclerosing cholangitis. So primary sclerosing cholangitis. Then in terms of conjugated, there is also the presence of the DJ syndrome. DJ syndrome is the Dubin-Johnson syndrome. Next is the involvement of the Rotor syndrome. There is presence of the Rotor syndrome, and there is also the benign recurrent intrahepatic cholestasis. So there is presence of the benign. So there is presence of the benign recurrent. So there is benign, there is recurrent intrahepatic. So it is intrahepatic cholestasis. Next, under the conjugated, there is also the presence of the progressive familial intrahepatic cholestasis. There is presence of the progressive familial. So progressive familial intrahepatic. So progressive familial intrahepatic cholestasis. Now let's look at the predominantly unconjugated hyperbilirubinemia. So predominantly unconjugated. So this is going to be predominantly unconjugated hyperbilirubinemia. Hyperbilirubinemia. So this includes the excess production of the bilirubin. So this excess, that is significantly increasing. So excess of the production. So there's excess of production, and this is going to be of the bilirubin. So excess production of the bilirubin. Next is the presence of the hemolytic anemias. So there is presence of the hemolytic anemias, and then there is a resorption of blood. There is also the resorption of blood. So the resorption of blood is from the internal hemorrhages. So it is from the internal hemorrhages. And example being the alimentary tract bleeding, as well as the alimentary tract bleed, as well as the hematomas. So the next stage, it includes the infective erythropoiesis. Next is the ineffective. So it is nothing but the ineffective erythropoiesis. So ineffective erythropoiesis, this includes the presence of the pernicious anemia. So it includes the pernicious anemia as well as the presence of the thalassemia. Next, in terms of the reduced hepatic intake. So reduced hepatic intake. Then the drug interference with the membrane carrier systems. There is drug interference, and this is with the membrane carrier systems. Membrane carrier systems, and there in some cases of the Gilbert syndrome and in some cases of Gilbert. So in terms of the Gilbert syndrome as well. Next is in terms of the impaired bilirubin conjugation. So in terms of the impaired bilirubin conjugation, and also in terms of the physiological jaundice. So physiological jaundice, and physiological jaundice means we are seeing in terms of the young newborn. So it is the newborn. So in the young newborn there is a decrease in the UGT-A1, so UGT1A1, and so this activity, as well as this decrease in the excretion. So decrease in the excretion. Next is the breast milk. So there is the breast milk jaundice. So in terms of the breast milk jaundice, there is a beta glucuronidase in the milk. Presence of beta glucuronidase, and this is seen in terms of the milk. Later, there is also the genetic deficiency. So there is genetic deficiency which is seen. So this genetic deficiency is where this is a deficiency of the UGT1A1 activity. So this involves also the Crigler-Najjar. So we're writing as CN syndrome, so Crigler-Najjar syndrome, and this will be type 1 as well as type 2. Next is in terms of the unconjugated, there was Gilbert syndrome and also the diffuse hepatocellular diseases. There is presence of the diffuse hepatocellular diseases. So diffuse hepatocellular diseases, it includes the viral or the drug induced hepatitis. So this viral or the drug induced hepatitis. So on the other hand, unconjugated, it contained few Rotter's, DJ syndrome, biliary tract obstruction, and BT diseases like the primary biliary cirrhosis, and then even the progressive familial intrahepatic cholestasis. To learn and grow daily like this, please do subscribe.